I want to start by thanking the officials in the Department of Health and those working in the HSE on the front line of this healthcare challenge. To those who have contracted the virus, I want to say very, very sincerely that I wish you well and I hope that you have a very speedy recovery. To those who are worried about contagion, I sincerely hope that they can get the comfort and the information that they need. Many of us here this evening have been privy to briefings, and the fact that we still have questions and questions are being asked here this evening must serve as a signal to the Minister that more information is needed, because if we still have questions after the briefings that we have, you can only imagine what people outside of this chamber, what the type of questions that they have. Minister, you well know that we have a serious and an ongoing issue with capacity in our health service. We know the causes. We've discussed the failings of government policy on many occasions at committee, in this chamber and elsewhere. I don't want to dwell on the policy decisions that have brought us here. However, the capacity of our health service to respond to the challenge of COVID-19 is dependent on the availability of staff. We've heard from the INMO that staff are queuing up to be hired. Their words, not mine, queuing up to be hired. That staff are available, but they are not getting contracts. Minister, they need to get contracts as a matter of priority. The recruitment embargo, whether you choose to acknowledge it or not, has to be lifted without delay. The emergency needs to be dealt with in a practical way, and the only way to deal with it is to recruit and hire more staff. We also need to be cognizant that a whole-of-Ireland approach is needed if we're to meaningfully address this challenge. That means that we have to have an all-Ireland public health approach that maximises the benefits of being a small island, while ensuring that we meet the challenges posed to us as an island. Practically speaking, this means harmonising the advice that is given north and south, ensuring provision of and sharing of capacity north and south. If necessary, a ring-fence dedicated all-island budget, a joined-up approach to the purchasing of essential equipment and devices, the unlimited sharing of medical information north and south. An all-island model of contagion needs to be developed. These are practical steps that will serve to protect our island. We manage the outbreak of foot and mouth as an island, and this outbreak should be treated no differently. Minister, you and I both know that the single biggest determinant of ill health is poverty. Those who are the poorest and those in the lowest paid work and the most precarious work are likely to be impacted very, very hard by this emergency. We are asking for you to waive any waiting period for sick leave so that those workers who get up early in the morning but who cannot afford to lose a day's pay are compensated. We're also asking that you be very clear with employers that they too have to play their part. I also want to take the opportunity to request that a plurality of voices are brought to the decision-making process from this Oireachtas. Not in any way to upset the work of the National Public Health Emergency Team and the HSE National Crisis Management Team, but to work to help with this serious public health emergency. With the greatest of respect to the caretaker minister, in a few weeks' time, he may not be the person who is in charge of the Department of Health, and for that reason, it is imperative that there is a high-level involvement from the main parties in this House, so that if the caretaker moves out and a new minister moves in, there is no time lost, there is continuity, and that person can hit the ground running. I would hope that this request is seen and viewed by you in the spirit in which it is intended, that is to be constructive in terms of making suggestions. And finally, I want to request that you focus at least some of your advice on those who are living with the consequences of the housing emergency. How can someone self-isolate if they're living in a family hub? How can a person who's in a homeless hostel self-isolate? Can I ask, will there be additional respite beds provided? If you think about that practically, Minister, if you are caring for someone in your home, you cannot self-isolate unless they can be cared for too. And once again, I want to pay tribute to those frontline healthcare workers who are at the coalface of this challenge. I want to pay tribute to those people in their families who are now dealing with this and who are trying to keep to keep good sense and ensure that good sense prevails, but who may need to access respite services and need to know that those beds are there, not that they're coming, but that they're there and that they can, in all conscience, self-isolate and do so quickly, because they want to act in the interests of public health, but they need to know that the government, albeit in whatever capacity, is going to be on their side, is going to provide the facilities that they need and is going to ensure that they respond to the needs of carers who have a very particular concern at this time of a public health emergency.